Namaskar, myself Dr. Aseem Jindal. Today I would like to welcome Dr. Neeraj Goel. Sir is a clinical lead and senior consultant from the Department of GI Surgery, GI Oncology and Bariatric Surgery, Dharamshila Narayana Superspeciality Hospital, Vasundhara Enclave, New Delhi. I welcome you, sir.
Thank you.
Today we will be discussing about gallstones and gallbladder cancer, which are not very uncommon. Sir, I would like to ask Dr. Neeraj Goel first of all, what is gallstone and how do they form?
Any calculus or the stone which forms in the gallbladder is a gallbladder stone. It is a very common disorder, I would say, which has been taught to us that a fat fertile female of 40 is a risk factor for development of gallstones. That is, if you are fat, if you are a female, if you are more than 40, you have a risk of development of gallbladder stones. ये gallbladder stones बनने का जो मेन रीज़न है वो है सुपर सेचुरेशन ऑफ ए सोल्यूशन. दैट मीन्स दैट सर्टेन crystals of cholesterol they super saturate and they settle down onto the gallbladder wall, and when they concentrate they form a gallstones. This is how this gallstone is formed, and basically it has been said that there is no specific risk factor as such, but few things that taking less amount of water is one of the things that can increase the formation of the gallstones.
So, sir, what are the symptoms of these gallstones?
Majority of the gallstones they remain silent, that is they are asymptomatic, but the most common symptom of the gallstone is the pain in the right upper side of your abdomen, which radiates to your shoulder, and it can go to the back of to the right side of your back. This is the major symptom. It is associated with nausea. It can be associated with vomiting. Sometimes when your gallstone is small enough to slip into your bile duct, it can cause jaundice, and if it gets stuck, it can cause cholangitis, which is development of fever with jaundice, and in some cases it can cause pancreatitis, which is the inflammation of the pancreas. It happens because your gallstones get stuck and the pancreatic enzymes inflame the whole system, and it is causing the acute pancreatitis. This acute pancreatitis can sometimes be life threatening also. So these are the few symptoms, and I would also like to comment that acidity may be a symptom of gallstones in approximately 10 to 15% of the cases. Not all the patients of the gallstones would be having acidity, and not all the acidity patients would be having gallstones. So these things require to be kept in mind.
So, sir, are there any tests by which we can diagnose these gallstones?
I would recommend that whenever you are having a pain in your right side of abdomen, you should go to your doctor. Your doctor would be getting a simple test of ultrasound. That ultrasound is a diagnostic test in seeing your gallbladder stones. It can very well, it is more than 99% sensitive and 99% specific for gallstones. You don't require any other test to diagnose gallstones. Side by side, we also get liver function test, so that we could judge whether the stone is stuck or there are certain complications caused by the stones, and certain ancillary investigations which might be required while we are operating on the patient.
As sir has said, ultrasound is the cheap and best investigation to diagnose gallstone. So, sir, after diagnosis, what is the treatment of these gallstones?
The treatment of gallstones which are symptomatic gallstones is simply gallbladder surgery, that is you remove the gallbladder. It is the surgery which is being done by laparoscopic, rather it is the commonest surgery which is being done by the laparoscopic means, that is the laparoscopic cholecystectomy. So this is the only treatment which is available for the gallbladder stones. Side by side, I would say that open cholecystectomy, that is you are giving a formal incision onto your abdomen, is now reducing in rate, and it is being done only when we are not able to proceed laparoscopically.
Sir, is there any role for medical management in gallstones?
Medical management is definitely there for the management of the gallstones, but the success rate is not good. Approximately 25 to 30% of the gallstones will be dissolving, and as soon as you stop your medications, you will once again be having gallstones. So it is not the treatment of choice for the gallstones, and the side effects are many because of these drugs which are given for these gallstone dissolution.
So surgery is the main modality for treatment of gallstones. And sir, we have received certain questions from our viewers, and I would like to ask these questions. The first question is, I had severe acidity for past many years, and my doctor got an ultrasound which showed gallstones. So what is the further course of action?
Dr. Asim, I just commented upon that in 10 to 15% of the cases, gallstones can present with acidity. But we have to remember that around 80 to 85% of the patients would be there in which the acidity is for different reasons, and this gallstone is an ancillary finding. So when you have symptoms of your gallbladder acidity and your ultrasound shows it is a gallbladder stone, the patient should undergo a gallbladder surgery, but he has to keep in mind that there is a chance that in some cases your symptoms won't be relieved of acidity we are particularly talking about. In such a case, these acidity symptoms can be very well taken care of by proton pump inhibitors or antacids. So we have to remove the gallbladder stones so as to relieve your acidity in case if it is causing your acidity.
Thank you. Sir, other question is, I have got an ultrasound for my gynae complaints and found to have gallstones. What to do now?
Dr. Asim, here I feel we are talking about asymptomatic gallstones. That lady has got her ultrasound done for some other complaints, but it is found on ultrasound that she is having gallstones, but she has no symptoms. As far as the literature goes, we don't operate on such a patient who are having asymptomatic gallstones. But I would say that in our area, in our I would say in our northern India, our gallbladder cancer is a pandemic. In the textbook of oncology, it is written that in endemic areas, if you have diagnosed a gallstones, even if it is asymptomatic, it should be operated. So my suggestion would be, when you have got a gallstones, you should get it operated. I am giving a very controversial statement, but this is my personal thinking, that because we are dealing with gallbladder cancer a lot, and gallbladder cancer can create a havoc, but that doesn't mean that every patient should get his or her gallbladder removed. We have to limit to this surgery to the patients who are having gallstones, not beyond that.
So just keep in mind, if you have gallstone, you need to be cautious about that and don't just ignore about it. Sir, another question is, I have got an ultrasound which shows gallbladder polyp. So what is this polyp and what to do for that?
Polyp is any formation or any outgrowth in the gallbladder. It is a kind of, if this is your gallbladder, there is a small outpouching which is a polyp. These polyps require removal if they are rather, it is single, more than 1 centimeter size, or it is symptomatic, it is causing you pain, then it requires to be operated upon. If I am doing an ultrasound serially to keep a watch onto the size of the polyp and its size is increasing, you also then come once again into the bracket of gallbladder surgery, because this becomes a risk factor for your development of the cancer. It has been seen, if a polyp which is more than 1 centimeter size, there is approximately 15 to 20% chances that you might be harboring a T1A cancer into that. So you have to get it removed when it is more than 1 centimeter in size, and the other things which I elucidated.
Okay. Another question is, I have been planned for surgery for gallstones. What can be the complications of this surgery?
Gallstone surgery, as we have been doing by laparoscopic route or the laparoscopic cholecystectomy, is relatively a safe procedure. The complications are very rare. The most dreaded complication, or the least common complication I am coming to, because it is causing the most problem to us, is the bile duct injury. But in approximately around 3 or 4 patients in 1000 patients would be getting this kind of problem, not more than that. So it is quite relatively a safe procedure. After surgery, there is not many of the problems. So I would say that it is relatively a very safe procedure, not major complications associated. If it is a simple gallbladder surgery, it won't take more than half an hour for you to get operated. You will be admitted on the day of the surgery. You get your surgery, and at our institute we discharge the patients very next day of the surgery. So the hospital stay is also not prolonged, and your recovery is very fast. Within 4-5 days you recover well, and you will be able to do your daily normal routines.
Another very important question which patient usually ask, like what will be the effect on my body if my gallbladder gets removed, and what do you say about that?
First, we have to understand that our gallbladder is not a necessary organ for our survival. It is a kind of organ which is helping us in digestion of the fat. Whenever you eat fat, your gallbladder contracts, it releases bile, and it helps in your fat digestion. So when I remove my gallbladder, that function is taken up by the liver. So majority of the patients don't have any symptoms post-operatively, but a few patients, because your bile now gets directly into your intestine, can have increased frequency of stools for earlier, I would say the first few weeks, but it settles down. Rather, I would say, because the fat diet is restricted with all these patients, because fat diet causes the symptoms of pain, rather the patient would be able to take that diet also. So his diet would rather improve rather than getting restricted. So in the post-operative, or rather after surgery, the after effects are not much. You will be living your normal life. There would be no problems with your daily routines.
So the surgery is very safe, and there are no dietary restriction, as well as sir has said. Sir, another question is, my sister underwent lap cholecystectomy and biopsy shows gallbladder cancer. Can gallbladder cancer be caused by gallstones? So sir, this has led us to now the problem of gallbladder cancer. As she asked, can gallstones cause gallbladder cancer?
Dr. Asim, this has led us to, you already said, to a gallbladder cancer discussion, I would say. Your question is whether gallstone leads to gallbladder cancer. We have no robust data to suggest that. It has been seen that approximately 97% of the gallbladder cancers patient would be harboring stones. But if we follow one patient, or rather 100 patients with the gallstones for long term, only 0.3 to 3% patients would be developing gallbladder cancer. So we cannot say that gallstones are causing gallbladder cancer. But definitely it has been seen, if you have a single stone more than 3 centimeter size, it has been associated with increased incidence of the gallbladder. We don't have any robust data, but definitely gallstones are present in a gallbladder cancer patient.
So there is no direct correlation between stones and cancer. So sir, what are the symptoms of this gallbladder cancer, and how do we diagnose
Before
it?
coming on to symptoms, I would just like to elucidate upon that our region, the northern region, rather I would say the Gangetic belt region, that is the area around where the Ganga flows, it has been seen there is a higher incidence of gallbladder cancer. We have not been able to find out the cause, but in the northern India, especially in the Himalayan region and these Gangetic belt areas, we have the highest incidence of the gallbladder, one of the highest incidence in the world. So we have to be cautious, because we are living in this area. We have to be cautious about all these things. Gallbladder cancer can sometimes be a very problematic thing. Your question was, what are the symptoms of the gallbladder? Gallbladder symptoms are no different from gallstones. You can have pain in your right upper abdomen. You can have symptoms of acute cholecystitis. If your gallbladder cancer increases, it can involve your bile ducts, and you can have jaundice. So the symptoms are not very much different. But the alarming symptoms along with the pain would be like you are having any anorexia, you are having weight loss, and your pain is not getting relieved, or you have started feeling some kind of lump formation in the right upper abdomen. These can be the few of the symptoms of the gallbladder stones. But whenever I have a pain in the right upper abdomen, I have to get an ultrasound beyond doubts.
So is only ultrasound necessary, or are there some other test for this gallbladder cancer?
Ultrasound is the preliminary investigation. It is the cheapest investigation available and easily available. It can tell us that yeah, this patient might be harboring a gallbladder cancer. Following that, when you approach your doctor, when you approach your surgeon, he would be asking you certain investigation, in which it would be a CT scan of the abdomen. Which, usually we get a triple phase CT scan. It is a phasic CT. Multiple CTs are taken so that we are able to see the vasculature. And sometimes if required, your doctor would be getting a PET scan also, so that to look at the spread of the disease. So these would be the investigations before any treatment is planned onto a patient of the gallbladder cancer.
So now coming back to that question, on biopsy, they detected a gallbladder cancer. What to do now?
Because as this laparoscopic cholecystectomy is increasing day by day, we are also seeing an increasing number of the cases of the gallbladder cancer which are being diagnosed after gallbladder surgery. Usually the good part of the things are that when such a gallbladder cancer is diagnosed, it is usually in an early stage. Usually a true, what we call this scenario as the incidental carcinoma of the gallbladder, that is, it has been found, that surgeon has not suspected, it has been found only on the microscopic examination. Usually these true incidental carcinoma of the gallbladders, they are early stage, usually T1A or T1B. So these patients usually do very well after when they have been operated further by the completion radical cholecystectomy. Your question is what to do now for this patient.
Yeah.
When we see this kind of a patient, we divide the gallbladder malignancy into T staging. If it is T1A, that is if it is limited to your mucosa, you don't require anything further. Your simple cholecystectomy is enough. But beyond that, you have to undergo a major surgery for the gallbladder cancer, which is called as a completion radical cholecystectomy, in which we remove the area of the liver where the gallbladder was stuck to the liver along with the lymph nodes around. So that completes the surgery for the gallbladder cancer. We have to bear it in mind that it has to be done as early as possible. We don't wait for the things to settle down. Once diagnosed, your surgeon has to intervene as soon as possible so as to remove the complete disease.
So to answer that question, you should seek the medical attention as soon as possible, as sir has said. Sir, we have received some more questions. My father has been diagnosed with stage 4 cancer of gallbladder. What is the further management?
This is a very unfortunate situation, I would say, a condition that patient of the gallbladder cancer has been diagnosed with stage 4. Gallbladder cancers as such are very much aggressive. They have very, I would say, tendency to spread very fast. So we have to be very aggressive in the treatment. In this case, this gentleman
Stage
has
4.
already in stage 4. So we can't do much about this scenario. The only thing is to palliate the symptom, that is the symptoms if what he is having, like jaundice. If he is having itching, if he is having jaundice, then we can palliate that symptom by putting a stent. Chemotherapy can be given to such patients in the form of palliative chemotherapy just to palliate the symptoms. If he is having some kind of pain, we might help out, but survival usually does not increase, and the survival is usually poor in stage 4 carcinoma of the gallbladder. So that brings me to one important point here. We should not be waiting for carcinoma of the gallbladder to come to such a stage. I have some pain, I have some problems, I have to consult my surgeon as soon as possible so that it can be diagnosed and treated at an earlier stage.
The another question is on jaundice itself. My sister had jaundice and our doctor tell us that she is having gallbladder cancer. Can she be operated upon?
This is a very tricky situation. A patient of the gallbladder cancer, how does he get a jaundice? He usually gets a jaundice when your gallbladder cancer directly goes into your bile duct or your lymph nodes are surrounding the bile duct and it is compressing onto the bile ducts. We cannot operate upfront of a patient who's jaundiced. Rather, the literature says that only 6 to 16% of the patient would be a surgical candidate. This is a very difficult situation, I would say. But we do operate on such patients once their bilirubin gets normalized by putting a stent and on investigations, if we find out that this patient is an operable candidate, we do go and operate upon such a kind of patient. So it is not that a basic notion amongst our surgical fraternity also that a patient of gallbladder cancer who is having jaundice cannot be operated upon. These patients can be operated upon if they are very much suitable for surgery, but definitely a very small fraction of these patients can be operated.
So, one question I would like to ask from my side is, how aggressive is this gallbladder cancer, and what is the prognosis? How does it behave?
I would say, as such, the nature of the gallbladder cancer is aggressive. It spreads very fast. As we have discussed this one question of a gentleman who has already stage 4. If the patient is already in stage 4, these patients usually don't survive for more than 6 months or maybe a year, despite of the best supportive care or whatever available. So this disease is quite aggressive, and we have to be very aggressive in treating these kind of patients. We have to be I would say rather we should be having two things. One is that a surgeon has to be vigilant. When a patient comes to me, I have to keep in mind that this can be the problem, and patient has to be even more vigilant that if I have this problem, I have to directly go to a surgeon and get myself treated by him. I should not be waiting.
So, this is an aggressive cancer and treatment should not be delayed. Sir, in last, to sum up all these about gallstones and gallbladder cancer, what would you like to share?
I would just say that these gallstones can sometimes be a very benign kind of problem. You can just be having simple pain, but it can become life threatening if your stone slips down into your bile duct and causes acute pancreatitis. And about the gallbladder cancer, I would say that please be aggressive in treating all these cancers. This would be a suggestion to all my surgical friends. And I would say that the patient has to be very vigilant to get himself examined and get himself investigated to have a look whether or not, God forbid, he is suffering from gallbladder cancer. Thank you.
So, I hope this discussion will be helpful to our viewers, and I would like to again thank you, Dr. Neeraj Goel, for such an enlightenment discussion. Thank you.
Thank you.